Hi guys, this video is going to be a part 2 to my initial video on how to become a cosmetic injector in Ontario. I've received tons of questions, so in this video I'm going to be talking about medical directors. So let's dive into it. First of all, how do I find one? So a lot of people have been asking me, how do I find a medical director? So there's multiple ways to go about it. It's a little bit tricky. You can't just hop on Indeed or hop on whatever website and search for them all that easily. So a lot of it is word of mouth, or I think the best and easiest way would be through the training school that you went to. Usually they try and connect injectors and medical directors because they train both typically. So they try to connect them with each other in order to help their students. If you're in Ontario and you're looking for one, you can always reach out to me as well. I'm more than happy to try and help if I can. Okay, now the next question is, what is the role of the medical director? So basically the role of the medical director is to prescribe the medication to the client. So whether they're getting Botox, fillers, PRP, they're prescribing or writing an order for you indirectly. When the client comes in, typically they just have you do everything. You have to do your consult, you have to figure out what you're going to do with them that day, everything, and then the medical director would just clear the client for the procedure, make sure that there's no nothing you missed or whatnot. And that's their role basically. And they would fill out a consult sheet and maybe sign some charts for you. They would prescribe the medication, the Botox, the filler, all the orders you would need. That would be the role of the medical director. They're overseeing your practice. They may not be in person. Majority of the time they are not in person, and they do their consults through Skype or FaceTime. And that's basically their role. Another role of the medical director, which is the very first thing they're going to do for you, is give you directives. Now, directives just refer to an act that, it's a document that says that physician or nurse practitioner so-and-so gives the directive to nurse so-and-so to perform the following. So each controlled act is a directive. So injecting Botox would be a directive, filler would be a different directive, PRP would be a different directive. They're all different. And for each directive, you would require a consult. If you choose that nurse practitioner route, which most nurse practitioners do it that way, not all of them do, but most do. So if a client comes in and they're getting Botox and fillers on one day, that's 2 directives. But it could just be done in one consult. But let's say they come in for Botox one day, that would be 1 directive and 1 consult. And then they come in a couple months later and they decide to do filler, they would do another consult, and that would be the 2nd directive. So there's a lot of little things that different physicians or nurse practitioners would do and like have their own little rules about how to go about these things, but that's generally kind of the general consensus. Next would be, who can be a medical director? So a medical director has to be either a physician or a plastic surgeon or a nurse practitioner that's trained in the medical aesthetics field. So technically any physician or nurse practitioner that did the 2-day course or whatever course you took with you is able to be a medical director. I mean, they're probably not ready to be one, but they have the qualifications in order to be one. Another common question I got was, how do I pick a medical director? Should I go with a physician or should I go with a nurse practitioner? And there's tons of factors to consider, so I'm just gonna break it down a little bit of what each option kind of looks like. So if you choose to go the nurse practitioner route, which is the route I took, basically what happens is your client comes in, you do your consultation, you clear them for the procedure, you make sure there's no contraindication, all that stuff. You decide what you're gonna do with them, all that kind of stuff. And then the nurse practitioner would see them just for a minute or so, just to go over everything and make sure that they're clear for the procedure. Different nurse practitioners choose to go over different things, especially as you're building the relationship with the nurse practitioner. They're gonna start to, have a lot of trust in you, and kind of those consults are going to be shorter and shorter as time goes by. And basically they would fill out a consult sheet, and that's basically what you're left with. Now, a lot of nurses do it virtually. So my nurse practitioner does not come in person. She just does a quick Skype or FaceTime consult with my client, and that's pretty much it. And with that route, basically the client has to see the nurse practitioner once a year per directive, meaning if someone comes in for Botox, that's one directive. So that would be one consult. And then most importantly, how much do they charge? So this is something like it's very hard to find any information on that. So I kind of have this little general how much do they charge type of thing. There's the percentage route, there's the charge per consult route, there's the charge per unit and or syringe injected route, and there's the monthly fee route. So basically, if your nurse practitioner or doctor charges you per consult, then that would just be a flat fee per consult. So when the client comes back, if they don't need another consult, then you wouldn't have to pay them again. Nurse practitioners like that typically charge between $30 and $60 per consult, I would say approximately. And typically when they just charge per consult, they're pretty hands-off type of medical director. I wouldn't necessarily recommend this route for a newbie just because they may not be of assistance as much as you'd need. Usually they just quickly clear your client for the procedure, and that's the end of that. And then the other route would be the percentage route. Usually they would take about 10%. Sometimes physicians like this route, or nurse practitioners, and basically they would do everything and just take 10% of the revenue. And they wouldn't charge you per consult or per prescription or per whatever, just 10% of what the patient pays. That's a rough estimate. Some may charge more, some may charge less. So this is a good route if you need more hands-on assistance or if you need more additional training. They're really trying to build that business with you. They're more invested because they're kind of a small shareholder, I guess. So that's one route to take, especially if you're new. I think it's not a bad idea to take that route. And then the other route would be a monthly fee. So basically a lot of doctors and plastic surgeons do that. They just charge you a monthly fee. This number varies quite largely depending on how big your place is. Sometimes bigger medical spas and stuff pay more, in the thousands of dollars per month. This varies a lot. It's going to really depend on who you choose and who you talk to, and how big the place is and how many injectors are injecting. And then lastly would be per unit or per syringe. I've seen it anywhere from 50 cents a unit to $2 a unit. And I've seen it anywhere from $50 a syringe to $100 a syringe injected. So there's that as well. And then there's people that combine a little bit of both. So they'll charge you a flat fee for a consult, maybe $15, $20, $30, and then a dollar amount per syringe and unit. So it really depends. Shop around, see who meshes with you well, and see what you need.